All right, we are live and all set to go.
All right, so I'm Dilip Jain, and I'm the Vice Chair and Acting Chair for today's Town of Northborough Board of Health meeting on July 19th, 2022. I'm going to just give a brief statement about the open law meeting. So the open meeting of the Town of Northborough Board of Health is being conducted remotely pursuant to the Chapter 22 of the Acts of 2022. An act relative to extending certain COVID-19 measures adopted during the state of emergency and signed into law July 16, 2022. All members of the Town of Northborough's Board of Health are allowed and encouraged to participate remotely. The act allows the Town of Northborough's Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed in the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Now, I'm going to do a roll call for all of our attendees, our board members. Okay, the chair members, when I call your name, please respond in the affirmative. Teresa Capobianco.
Present.
Lisa Johnson.
Present.
Swati Sane. You're muted.
Sorry, I'm on mute. Present.
Dilip Jain, present. Staff, when I call your name, please respond in the affirmative. Katie Holt.
Present.
And Michael Sager, our health agent.
Present.
Okay. So let's go to the first item on the agenda is the revised variance request from lifeguard requirement at the North Court pool. A representative from North Court is here. Jim, is somebody from North Court here?
Yep, I just brought in Jacob. It looks like he's connecting right now. It may take him a moment.
Okay.
And then did you say was Andrea the other representative as well?
Andrea Edmonds, I believe, is one of them as well.
Welcome, Andrea and Jacob.
Thank you. Thank you for having us.
Sure. So I'm not sure who's going to speak first or so that
I
we don't.
am.
Okay, great.
Okay, I'll start by introducing myself. My name is Andrea Edmonds. I am a member of the North Court pool community. I am also a trauma nurse and a public health nurse, and I share that because I share that same safety lens as you do when it comes to the pool and our members' safety.
Okay.
So I don't want to read through this whole proposal. I think that you all read through it, that I sent through email, unless you want me to go through it.
Yes, that would be helpful.
Okay, so I listed on North Court's current safety policies. What we're doing right now, we have lifeguards Monday through Friday from 9 to 4. Saturday, Sunday from 10 to 4. The availability is tough. There's not a lot of lifeguards available at this point, and their hours are limited on what they can work, and the cost of it as well. But we are maximizing it to the best of our ability, which makes what makes sense for our high usage times for the pool. After 4 o'clock is really, everyone kind of goes home to make dinner. So it's really quiet at that point. Parties require a privately funded lifeguard. We have a 6-foot security fencing, all kind of in line with the state requirements. We have a low flow return water inlets, depth markers, non-slip surfaces. There are no blind spots within the pool area. The pool is rectangular, no diving boards. Our access is restricted to members only, and only members that are above 18 have a key that's provided to them. The pump house has additional lock features so that only certain people can get into that pump house if need be. We also have an emergency phone poolside. When you open it, the address is listed where you are. So just in case in that high tense moment, people can make sure that they remember where the pool is. We have plenty of rescue equipment, which I sent some pictures so you can see exactly what we have. We have a number of safety signs. We are also maintained by a CPO weekly, and we also have a pool manager that maintains this pool daily with the lifeguards. We do daily testing 4 times a day in line with the state requirements. So we are asking for this variance to keep the pool open from 4 to 8 with a few more safety nets in place and some limitations. So we would like to do some pool attendance from 4 to 8:30, which is very low use times. After 8:30, the pool would close. These pool attendants would be CPR certified. The Northborough Fire Department has kindly offered to certify any of our pool members for free, just the cost of the card. No more than 10 swimmers in the pool per pool attendant. So if there's 2 pool attendants, then you can have 20 swimmers in the pool, but no more than that. A site visitation with the fire chief from Northborough to make sure that he knows exactly where we are, because it's a little bit of a dirt road that goes back into the woods, but we have emergency access directly to a pool that has double gates to allow for, a stretcher to come in or that kind of thing in quick, easy out at that point. And then we also have approval from our insurance company verbally at this point, saying that it's not depending upon the use or the non-use of guards. Really, they just want the sign up that says swim at your own risk, no lifeguard on duty. So that is our proposal at this point. I personally feel that this is a safe environment while continuing the community being together, especially after COVID. And so I just wanted to get your feedback and feel and understand whether you think that this is safe for our community as well, or if we need to add any more safety nets as well.
Okay, so if I understood correctly, you do have the signage up that no lifeguards on duty.
Correct.
After the certain hours, or that's up all the time?
It's not up while the lifeguards are there.
So it's not up. So you put it up after the lifeguards have gone for the day at 4 o'clock.
Correct.
And then swim at your own risk. What's the other sign?
It is, let's see, can I screen share and I can show you the
Sure.
exact copy of the sign?
Will she be allowed to screen share, Jim?
I think so. Let's see. Host disabled participant screen sharing.
Jim?
I had just changed over that option, so you should be able to do that.
Great.
Change it now.
Thank you.
Perfect. Thanks, Jim. Let's see. So here is that sign. Can you all see that?
Yes.
Yes.
Okay. And while we're right here on the page below it, I can share with you this past Sunday, July 17th at 2 p.m., 90 degrees out. This is high usage for our pool. This is what it looked like in attendance. That's really the most we will find at that pool. It's not like a hotel pool or even a gym complex pool. It's really quiet. And it's all families with their younger children.
Now, is there a sign for underage swimming by themselves? I don't see it on the pool rules or anything like that.
So we do have a sign. Let's see, let me get up to here. Children under the age of 16 should not use swimming pool without an adult in attendance. Now, they can't even get into the gates because they're locked unless they have a key, and only people who are 18 and older can have a keyed access to the swimming pool.
Okay. Right.
This is, I think I skipped by. This is our safety equipment, along with the first aid kit right outside the door. This is our emergency phone that is checked daily by the lifeguards. And when you open this latch right here, it is the address that's provided on a piece of paper inside. I also have a video if you would like me to share with you to kind of give you the view from how far the street is to the entrance of the pool. So you can get a better idea for the property if you've never been there.
Any other board members have any questions or concerns?
I had a question, Andrea. When is the fire department? Is it the chief who will be making a visit?
Yes,
Okay. And do you have a date already scheduled?
we don't. I just wanted to make sure that that works for you and you didn't have any other requirements before I spoke with Ed.
Okay.
Dilip, I have a question, if that's all
Please
right.
go ahead. Go ahead.
My daughter's a lifeguard. Actually, she's working. She's a lifeguard right now. And I meant to ask her this question this morning, but I forgot to before she left. How many individuals is a trained and certified lifeguard permitted to guard at any one time? What's that maximum number?
Sure. So it's 25 per guard. So we
Okay.
always have 2 guards on board. Here, let me stop screen sharing so you can see my face. We always have 2 guards on board. We're not required to, but I just felt from a safety perspective, if anything were to go wrong, I want to make sure that there's 2 people there to support each other, one, and to be able to lift that backboard out.
Sure. Is there a minimum requirement for the attendant level?
There's not actually. So we kind of thought 10, it was the number we thought was safe enough for people to watch. 10 per attendant.
Okay.
It seems though Framingham and Westboro are doing the similar things with busier pools than us. I mean, at our high point, there's maybe 15 people in that pool total.
Okay. And so the attendants are separate and distinct from the parents who should be there watching their kids in any event, right?
We were hoping that that's who we could CPR certify with a parent. So if you wanted to go down with your family,
Mm-hmm.
that you would be CPR certified with another adult and your children.
Okay.
In the pool. So
Okay.
everyone's kind of responsible for their own unit.
Are families allowed to bring guests?
They are, but there's a certain limitation to those guests.
Okay. And so do you envision a scenario, excuse me, where one family is bringing like 8 or 10 kids down with them?
No, because there's a certain number, and Jake, correct me, over a certain number is considered a party. And for a party, you absolutely
Yeah.
require you to have a lifeguard.
I did see that requirement and that was fine. All right. So
That's correct. Anything over 5 would be considered a party, and we require them to pay for additional lifeguards as required. So.
okay. So based on what you've just answered for me, I don't have any problem with this variance request.
Thank you.
Let me just ask one more question. So because it takes 2 people to bring the backboard out of the pool, in the evening, would you also have 2 people who are also trained as well when you only have 4 people there? But if one person's in the water and needs a backboard, what do you do?
That's why we said with another adult. So someone else could make sure that they can
Oh, okay.
help. It's not a requirement. It was just a personal feeling that the board had that we didn't want, our guards are in college. So we didn't want a young adult to be so afraid and kind of alone in this. So we just added that extra precaution.
Okay. Now, when does your pool close?
So it is dependent upon our pool company when they can come to close it, and it's dependent upon the weather.
Okay, so it could go into September or October, potentially?
It can. However, Jake and I don't want to, I have to start school come August 31st this year, and Jake has got to wind up with his job as well. So we don't really want to care for it that late into the season.
So all the past seasons, at least I think we've been members for 5 years. Labor Day weekend is generally the last full weekend of swimming. And at that point, it's we start the procedures for winterizing it. So
Okay.
Yeah.
Right. That would make sense because the college kids are going back to school. They're not available to lifeguards. Then you're going to be totally lost without the lifeguards. And that's why I was wondering if it's going later than Labor Day, where's the support system coming into place? So
Yeah. And Most of the kids are back to school at that point. Parents are back at work, so it doesn't get much use.
Okay.
It's a waste of chlorine.
Anyone else have any concerns? Lisa? Any concerns about the variance being requested
it's-
by the North Court?
Teresa, you pretty much spoke for me.
Okay.
You asked questions that I had. I was thinking about the bather load capacity. I'm really in favor of a lifeguard being there anytime the pool is open. So I think going forward, that may be a conversation to have if we grant a variance tonight. I mean, your pool seems very safe. Everybody is engaged to do a lot, but we have more data in public health, as you know, Andrea, and our job in the Board of Health is to protect the town, and nobody has any anticipation of any tragedy happening, but it would be really awful if something did happen. So I think going forward, this conversation should be re-engaged for 2023, but I agree with Teresa that I think a variance would be reasonable for the rest of this pool year.
Okay. Would somebody like to make a motion for that? Teresa?
Sure.
Two quick questions. Sorry,
Yeah, sure.
Dilip. One is, should the variance should it be yearly? Like
It is
Lisa
yearly for
pointed out,
It's
it is
yearly for the pool. It's based on the pool permit. They have to attain a pool
Okay.
permit every year. So it's
Okay.
going to be coincide, and then they will have to ask for the variance pretty much every year.
Every year. Okay. And then can the minimum age of the pool attendant be specified in it? I'm sure it's an adult who is, doing the training, but, put in as whatever, 21 or whatever the board feels comfortable with.
Sure. So I'm actually also a CPR instructor. And so I'm thinking of it from that point of view that I guess I would certify someone who is 18 or older. I'm just worried about the strength. I want them to be able to compress the chest. If it was a 16-year-old that is taller, yes. So I'm just talking from the strength perspective, but from that frontal lobe that needs to be developed, I think 18 is safe.
Okay. Yeah, as long as that's specified
younger than
in
that.
there. Yeah.
Sure.
Any other questions, queries, concerns from the board members? No? Swati, all set?
Yeah, I think I'm all set.
Okay. Teresa, go for it.
Okay. So I would make a motion that we approve the request for variance submitted by North Court Pool, allowing that variance for the pool season of 2022 only to expire upon the closure of the pool, and with the additional condition that the pool attendants be over the age of 18.
Anyone seconding it?
I will second it.
Great. So all those in favor, Teresa,
Aye.
Swati,
Aye.
Lisa,
Aye.
and Dilip, aye. So the variance is passed. All right, guys, go enjoy the rest of the summer.
Thank you very much. You as well.
Thank you.
Thank you.
Thank you. Have a nice day.
Thank you. Jim, are they gone?
No.
Yes?
Yes.
Okay. Who was there at the last request for the variance?
I think
I was there, Dilip.
Yeah, and Lisa, were you there too?
I was there. Yes.
Okay, what a difference in the presentation between
Yeah,
last time and this time.
Well, they needed to. They
Well,
needed to show
I
us
mean,
what they could do.
Last time was like, this has to happen. I expect it to happen, whatever it was. And I mean, she just came in totally, of course, her background has something to do with it, I'm sure. That helps, but totally different approach. But anyways, I don't want to get off track. That's
Well, it was a
off
good
the
theory.
record, Katie.
Right. A good serious conversation about,
Yeah, I
Well,
mean, she
safety.
understands the seriousness. She
Yeah.
understands where we're coming from, but a totally different approach to try to sell something.
Great.
That's all.
Yeah.
All right.
I watched that hearing last night. It was a very different hearing.
Right, exactly, right? I mean, I was like, okay,
Yeah.
I expected this to be a battle, but she kind of did her job and she did it very well. So,
Right.
anyways, the second item on the agenda, we're going to welcome our new health agent, Michael Sager. Welcome, Michael. Now you're going to give you the floor to tell us a little bit about yourself, your background, and how you're going to help us.
Fantastic. I appreciate that. As you said, my name is Michael Seeger. I've just started last week. It's been an eventful week so far. Get my feet wet quickly with Kristen away. I spent the last 4.5 years working for a company called Ecolab. They're a third-party auditor. Doing predominantly grocery stores, but a lot of food service mixed in with that as well. Prior to that, I spent about 25 years in food service management. So managing restaurants, cafeterias, and mostly chain restaurants all throughout Massachusetts. Very excited to be here. I spent my entire career developing the skills and the knowledge base to move from management to understanding how important public health is and the role that the auditors have, the Board of Health inspectors and so forth have. So I'm also a Northborough resident, so very excited to help out my communities in every way I can, help the board and help the town.
Excellent. Welcome aboard.
Welcome.
Look forward to working with you and
Welcome.
hearing your reports.
I did a few quick ones this morning, but I'm getting my feet wet very quickly.
Yeah. Great. Anyone have any questions for Michael?
I think it's his
Only-
first week, so we could spare him.
Yeah. Actually, I do. I only have a question. If you have had to go visit Kumar's yet, how are they doing? That's my only question.
I identified Casa Vallarta and Kumar's as two of the problem children in the town. So I already made a visit to them yesterday, introduced myself, presented my business card, and so I'm looking forward to working with you, not against you. We're here to make everybody safe, everybody healthy, and hopefully keep their doors open. Well,
Good.
for their sake.
Yeah.
But for whatever needs to happen. So
Yeah.
I made the connections yesterday.
Okay.
Good. You know, it's amazing. I mean, I've been on this board for quite a while, and it's amazing how the restaurants rotate through their bad times. And you know, there were a couple of others that were going through the same type of scenario quite a few years ago, when Jamie was our Board of Health agent, and it was different. But anyways, so welcome. We look forward to working with you and hearing your reports and seeing all the stuff that you can bring to us.
Thank you.
Anyone has any other business, old, new, anything to talk about? I mean, we don't have any COVID reports. The numbers, I can say, you know, the numbers are going up. Okay, the percentage, and I think it was at one point anywhere from 6 to 10. I think it's closer to 10 now. Across the state, getting beds is tough. So it's a challenge. So we just got to be aware. You know, I heard in Boston that they are thinking about going again indoor masking and also outdoor masking. So things are changing a little bit. We just have to keep an eye out and, you know, make our decisions based on that for the town. You know, going forward. But, you know, we don't have any COVID reports right now. And, you know, a couple of other things. I know they talk about the wastewater reports, but unfortunately in the town of Northborough, you know, half the town is septic systems. So there's no reporting from the septic systems. Okay. And same thing for well water. And so, you know, if you have COVID and you have septic, it's never going to get caught. If you did a home test, it's never going to get caught. So I suspect the numbers are higher than what they are claiming to be or reporting to be. But let's see, the deaths are not there. So I guess not as high as they were the first time around, but the numbers have gone up. So just all of you be careful. That's all.
Dr. Jane, I do have a question about it, since either you or Dr. Sani may know. Are we finding that this most recent strain, which apparently is extremely contagious, is it causing an increase in the amount of hospitalizations or severity of symptoms as some prior versions, or are we seeing that it's just we're just really annoying?
Well, at least from what I've seen, I mean, just to give you an example, okay, so my son got COVID about 4 weeks ago. No one around him had it. Now he believes he got it from work because group came from Ireland and they went out and they, et cetera. So he believes that's from, no one had symptoms. We were in Savannah 2 weeks ago, and no one had symptoms in the group of 14. My son's 30th birthday, he proposed to his girlfriend, all that stuff happened. And she gets a cough the night before. We leave to come back, and things with allergies, the air conditioning was set at 62 because it was 95 degrees outside, all that. So you think it's all of that, and comes back and she still doesn't feel right. So on July 4th, she tests herself and she's positive for COVID. Okay. Now I've been around her all that time. I had zero symptoms. And, I have medical health issues that would put me at higher risk.
Right.
I tested a home test negative. I did a PCR, was negative 5 days later. I have had zero symptoms, and I was about as close to her as you can possibly get with somebody with active COVID. Now, she ended up getting sick with it. She wasn't hospitalized, but she did get the monoclonal antibodies. Of course, I think part of that's being an employee at UMass. Yep. Being a physician, they want her back at work, so they're going to do everything possible to get her well quickly. So she got her monoclonal antibodies and stuff. I don't think that made a difference for her. It still took her 2 weeks to recover. So, take your pick. And she doesn't have any health issues. So I don't know how to tell you anything specific. People are getting hospitalized with it, especially those that have chronic underlying problems. They are getting hospitalized to protect them and to also isolate them from other people. But this variant, of course, is not, don't forget, this variant is not in the vaccine.
Right.
Therein lies the problem, right? So all these variants that have come through after they have not produced new vaccines since the beginning. It's been the same strain that they came in, the Delta variant that was originally present. So all this Omicron, the BA2, BA5 that's out there now, none of these things are in the vaccine. So, unlike the flu shot where they change it every year.
Right. So would the vaccine not make a difference one way or the other at all in terms of?
I think it helps.
Okay.
I think it helps a little bit, but I'm not sure how much, because even Fauci also said last week, right? He's not sure how much this is going to help against the new variant.
Okay.
That being said, I guess it's better to be vaccinated, at least fully with 2 doses. If you've got the boosters, even better. But again, right now, there's no this thing, and people who have who've had the vaccine, have already had COVID once, have gotten it the second time.
Yeah.
And then there's people like me. Of course, I'm isolated, I'm working from home, but I've gotten the vaccine and 1 booster, and with the health issues, I have not gotten it yet, touch wood. But, I don't know. It is such a weird condition. I'm not sure what Swati's seeing in the office, but I can't imagine it's being much different.
Yeah, fortunately, parents are calling with positive home tests. We are not seeing as many sick kids as we did back in January and February. So the caseload is there, but it's not as high as it was in winter.
For the kids.
And fortunately, they are recovering quickly. They are not being hospitalized.
Good.
Of course, there are other respiratory illnesses going around, and we are seeing a lot of pneumonia, and we were seeing flu until end of May.
Wow.
End of May, early June, and flu with bad sinusitis. I've never had kids being admitted for sinusitis in the past. It's just weird. The whole, we are just seeing things so much differently and different times of the year. It was so predictable. Flu ended in March.
Yeah.
We knew what other viruses would be around later on in spring, but now everything is unpredictable.
Now, you're just curious. So, with all these kids who have these sinusitis and pneumonia, I'm sure obviously they're all getting tested for COVID at the same time to make sure it's not a double whammy. Do you find the sicker ones are the ones with underlying respiratory conditions like asthma or nothing, or nothing like that at all?
No.
Okay.
Yeah, and many of these kids have had the flu vaccine. So, but again, the efficacy is good for 6 months. They got it back in September, October, and
it's done by April.
It's done. So probably we need to think like in tropical countries, where they give the flu vaccine in the summer months, the monsoon season.
Or delay the flu shot instead of September, or like the pharmacies give it in July. Delay it to like actually November. So that you can get a full 6 months coverage. Because I used to be so afraid when patients used to get the flu shot. I used to get it from the pharmacy. They got it on July 20th. I was like, "Are you kidding me? It's going to be done in February." what are you going to do after that when peak flu season is there? So, okay, good. Any other discussion on COVID or anything, guys? No? All right. So we do have approval of minutes. Unfortunately, June 14th, we cannot do because Glenn was at that meeting, so we cannot review that today. But May 10th, we can because Teresa, Lisa, and myself were there at that meeting, so we could approve that one. So anyone had any issues on the May 10th meeting minutes?
No.
No?
It looks
Lisa?
good.
Looks good.
Yes.
So I make a motion that we accept the meeting minutes of May 10th, 2022 for the Town of Northborough's Board of Health meeting as written and submitted. All those in favor, second it. Great.
Yep.
Teresa, all those in favor? Teresa?
Aye.
Lisa?
Aye.
And Dilip, aye. So that is accepted and passed. And the last item on the agenda is future date, August 9th, 2022. Unless it gets postponed for whatever reason, like this one did.
Yeah.
Anyone's on vacation that time?
I'm not sure if I could join. I always have the second and the fourth Tuesdays. I have meetings in the evening, so I could come in, but I may be, rushing and maybe late.
Okay.
Yeah.
I know. I know Kristen had talked about possibly moving it to another day.
Right,
Something about the Zoom license, but she's not here to address that. So maybe,
I actually, I reached out and it looks like the third Tuesday of each month might not be an issue. I think there's only one, like as long as it's remote for now.
Okay.
Yeah, so.
It works for all the other Board of Health members and.
That would be fine. I don't mind changing the Tuesday, especially if that helps you.
Yeah,
Thank
so
you.
do we want to look at the 16th instead of the 9th?
that works for me, at least for the four of us that are here, which basically is the
Only-
majority.
The only thing is, in August, both Kristen and I are both on vacation the 15th through the 19th.
Oh, so
So
Kristen's on vacation again, so she'll be,
Yeah.
oh gosh.
Should we
Michael's
skip
gonna have to-
August? Should we skip August and?
Yeah, I mean, I
September?
suppose we could probably skip unless something major comes up.
Right.
You know?
So why don't we look at it this way then? Barring any urgent thing, like, I mean, really the only two big items today were meeting Michael and the North Court thing. And Michael, we know he's here. We've heard about him through Kristen. We could have met him officially next month as well. Unless something like North Court comes again, maybe we cancel the August meeting. Otherwise,
Yeah.
tentatively, why don't we schedule it for the 9th?
Yeah.
Just in case, because, not having Katie or Kristen here, I mean, I think we would not be able to conduct this meeting, even though Jim's good about doing the video stuff. But having Kristen and Katie here, I think is helpful to keep us on track and in line. That sound reasonable, guys? So we'll keep it for the 9th
Yes.
for next month. And then if nothing is there, then we can always cancel that meeting, and then we're free to do whatever we need to. That sounds reasonable?
Yep.
Yes.
Okay, anyone want to make a motion to adjourn? Hey,
Motion.
guys, we finished this in 35 minutes.
Even a chair.
I think it's a new record. It's
I'm gonna send a message to Glenn after this.
Yes. I think Glenn just got rotated out of the chair position.
All right, somebody want to make a motion to adjourn, please?
So moved.
All right.
Seconded.
All right, good. So everyone have a good rest of the summer. We'll see you August 9th, barring cancellation.
Thank you.
Enjoy.
Thanks, you too.
Thank
Thank you very much.